we have been trying to address key issues of trying to make sure the health services are available to the average Ghanaian at an affordable cost, and also making sure that the quality is good. So in terms of, I would say that for the availability of the services, we have, I would say, a policy which is trying to make sure that service delivery through the primary health care is at a very low level. We used to have what they call the chips. That's making sure that we have services at all levels, particularly at the community level. We have had that system running for about a decade now, but that system has had a little challenge. You will realize that going from the community up to the district, the health center has been weakened. So we have actually come out with a new policy or a new strategy, which is called a network of practice. By so doing, we try to build capacity at the health center, which is called the model health center. And they will now connect all the structures that exist in the community level to that model health center. And we are thinking that when that is put in place, then the flow from the community to the district will be strengthened. And then there will be very minimal pressure at the district hospitals. So that's a new strategy we are using as a country for the network of practice. In terms of, I would say, the financial access, Ghana has had our health insurance, which is a pro strategy for the past 20 years now. And it offers about 95% of the services in the country are actually covered under health service and under the National Health Insurance Scheme. What I think is missing is there's very little support in terms of preventive and promotive. And that's one area that we are trying to engage to renew so that that part of the delivery is delivered. For the quality of services in terms of access to vaccines and medicines, that's one sure way that we have been doing over the period, working with all key stakeholders, including the National Health Insurance. So I would say that for Ghana, our main goal is to offer quality essential services to all Ghanaians at a very affordable cost. And so far, it has not been bad. We are using the strategy around the primary health care, which has been quite good. We have been able to address critical outbreaks even over the past 2-3 years, even in the midst of the pandemic. It's all because our health system has been strengthened over the past 2 or 3 years. WHO has been a very key partner for the Ghana Health Service or the Ministry of Health over the past, I would say, half a century. And this has been critical in the areas of communicable, non-communicable diseases, in health system strengthening, in managing outbreaks, in the provision of technical and financial support over the years. I would say that if you look at the last year, when we had an obvious challenge of how to improve on our non-communicable diseases, they partnered Ghana to come out with this international strategic development program, whereby we brought together global players to the country. And that was a collaboration between the Ghana government and the Norwegian government and then WHO. I would say that by virtue of WHO, a lot of key partners have visited Ghana, supporting us in delivery of our services. And one critical area is non-communicable diseases. In terms of emergency management, we've also supported with other partners, including CDC, to make sure the capacity has been built. I think that our strength as a country has largely been built by the technical and the financial support we've gotten from WHO. They've supported us in all spheres in our delivery, in terms of strength at the borders, strength within the country, and then building capacity of our health staff. In terms of even our human resource capacity, they are very crucial for us in helping us to make sure that we get the quality of service that we need as a country. So let me say, in recent times, Ghana has had a number of outbreaks, even in the midst of the COVID-19 pandemic. We've had Lassa fever, we have had Marburg, we have had yellow fever, we have had polio, and quite a number of them. And what I want to say is that Ghana started preparing towards outbreaks, I think long before the COVID-19 came into being. So after the joint external evaluation, we had the gaps identified in country. they decided to build the capacity along the thematic areas of surveillance, point of entry, laboratory, miscommunication, finance. So those were the thematic areas that we tried to build our capacity on. So one crucial thing was that we don't have what we call rapid response teams in the country. So we try to make sure that at least at the national level, we have those teams in place, and then also at the regional level. And then we try to build capacity in our surveillance teams, really at a very low level, so that we have a very sensitive surveillance system. So though we've had a number of the outbreaks, one thing which is good is that we detect it very early and then we contain it. So it doesn't become so big for it to overwhelm our health system. So that has been a very good system that we have used. We have also built capacity in our laboratory systems. Initially, we used to have, let's say, one main laboratory, which was Noguchi. Now, as we speak, we have reasonable number of our laboratories who are able to do confirmation and then guide us to respond very early. That has also been one good thing for us. Then I would say that our port of entries, we've tried to build capacity also at the port of entries. We've done a general assessment to know the gaps, and by virtue of other partners, including IOM, JICA, WHO, we try to build capacity at the point of entry, all in the hope that if a pathogen should come to the country, we detect it at the source. Our surveillance system has become very electronic. So we are doing what we call more of the EIDSR. Before the advent of COVID, we had a pilot of a system called the SORMAS. But then when we had SORMAS, we rolled it out. So now we have a nationwide e-surveillance system that is helping us to detect and respond early. And I think that we have used that opportunity to help us respond to outbreaks very early. And the capacity has been built not at the national level, at the region and then the district levels over the period.